The man is turning blue. His hands claw at his throat, fingernails digging into skin, leaving red scratches that well with pinpricks of blood. His mouth opens and closes like a fish on dry land, gulping for air that won't come. His eyes are wide with terror, bulging from their sockets as his face transitions from red to purple to that dusky, cyanotic blue that signals oxygen deprivation. He's dying right here in the ER waiting room, 10 feet from the triage desk, surrounded by 24 witnesses who watch in frozen horror. Someone help him. A man in the corner jumps to his feet. He can't breathe. I'm already moving, pushing through the crowd of patients and families. My brain catalogs symptoms even as my feet carry me forward. Acute respiratory distress, possible anaphylaxis, angioedema, foreign body obstruction. Does anyone know what happened? I shout as I reach him. He's on his knees now, still clutching his throat, his whole body shaking with the effort to breathe. He just started choking, someone says. 1 minute he was yelling at his wife, the next minute he was, "Call a code." I snap at the triage nurse. "Get me an ambu bag, EPI, intubation kit. Now." The man makes a horrible wheezing sound, like air being forced through a straw. His lips are almost black now. 30 seconds, maybe less, before he loses consciousness. Maybe a minute before irreversible brain damage. I grab his jaw, tilt his head back, look into his mouth. His tongue is massively swollen, pressing against the roof of his mouth, blocking his airway. Not a foreign body. Angioedema. Anaphylaxis. EpiPen. I yell toward the triage desk. "Someone get me epinephrine, 0.3 milligrams intramuscular, stat." A nurse rushes over with the emergency kit. I grab the EpiPen, remove the safety cap, jam it into the man's outer thigh right through his jeans. The spring-loaded needle deploys with a click. I hold it there for 3 seconds, then pull it away. Come on, come on. The man's eyes start to roll back. His struggles weaken. He's about to code. Does he have any allergies? I look around frantically. Anyone? Does anyone know if he's allergic to anything? What did he eat? What medications is he on? Silence. The crowd of onlookers just stares, useless. Then I see her. A woman standing 15 feet away, back against the wall, arms crossed over her chest. She's maybe 35, medium build, dark hair pulled back in a ponytail. She's wearing scrubs under a jacket, medical scrubs, I notice. Navy blue, the kind nurses or paramedics wear. And she's staring at the dying man with an expression I can't quite read. Not horror, not concern, something else, something cold. "You," I point at her. "Do you know him?" She doesn't answer, doesn't move. Just keeps staring at the man who's now completely limp on the floor, his breathing reduced to barely perceptible gasps. "Ma'am, I need you to tell me if you know this man. Now." Still nothing. Her face might as well be carved from stone. A security guard steps forward. That's his wife. They came in together. She's been sitting with him for the past hour. Then she knows his medical history. I lock eyes with her. "Ma'am, your husband is dying. I need to know, does he have any allergies? Is he on any medications? What did he eat in the last hour?" The woman's jaw tightens. Her arms pull tighter across her chest, but she says nothing. Just stands there, watching her husband suffocate 6 feet away from her. "Ma'am, please. He's allergic to penicillin," she says finally. Her voice is flat, emotionless. "And shellfish. Did he eat shellfish today?" A pause that lasts too long. A pause that feels deliberate. "Ma'am, did your husband consume shellfish? Shrimp?" The word comes out clipped, almost spat. "He had shrimp tempura from the food court before we came here. I told him not to. He ate it anyway. Jesus Christ. Anaphylactic shock from shellfish." That explains the rapid onset, the severity. But something about her tone, about the way she's standing there with her arms crossed while her husband dies. The epinephrine still hasn't kicked in. His airway is too swollen. I need to get oxygen into his lungs another way. I need a surgical airway kit, I tell the nurse. "We're going to have to do a cricothyrotomy. I'll get Dr. Patel. No time. I'm doing it now." The nurse hesitates only a second before running to get the equipment. I look back at the woman against the wall. Our eyes meet, and in that moment, I see something that makes my blood run cold. She's not horrified. She's not panicking. She's not even particularly upset. She's waiting to see what I'll do. Waiting to see if her husband will die right here on this dirty waiting room floor. And part of her, maybe a small part, maybe not so small, is hoping that he will. What the hell happened in that waiting room before this man started dying? 4 hours earlier, my shift had started like most Thursday afternoons at Hospital St. Halstead. The A was busy but manageable. A steady stream of patients with the usual complaints. Chest pain, abdominal pain, minor injuries, chronic conditions that had flared up. Nothing dramatic. I'd been assigned to the fast track area, the section reserved for lower acuity cases. Sprains, lacerations, minor infections. Good practice for a resident. Dr. Patel was the attending supervising me. She'd checked in twice, reviewed a few treatment plans, offered guidance. Otherwise, she left me alone to work through my patient queue. By 2 p.m., I'd seen 11 patients. My coffee was still warm, and I was in that comfortable rhythm where everything felt manageable. That's when the first alarm bell went off. Not a literal alarm, just that subtle shift in atmosphere that happens when something's wrong. A raised voice from the waiting room. Not unusual people get frustrated waiting, but this voice was different, harsh, aggressive. I was documenting a simple ankle sprain when I heard it more clearly. So fucking stupid, Linda. I told you we didn't need to come here. But no, you always have to overreact, always have to make everything a bigger deal than it is. I looked up from my computer. The voice was coming from the waiting room, visible through the glass partition. And now we've been sitting here for 2 goddamn hours because you insisted on coming to the EA for something that could have waited until tomorrow. I couldn't see the speaker yet, but I could hear him clearly. The waiting room had gone quiet, everyone turning to look. "Sir, please keep your voice down," I heard the triage nurse say. "There are other patients waiting. I don't give a shit about other patients. My wife dragged me here for nothing, and now she's wasting everyone's time." I stood up and walked toward the waiting room entrance. As I rounded the corner, I saw them. A man, maybe 40 years old, sitting in one of the plastic chairs near the vending machines. White, stocky build, wearing a polo shirt and khakis. His face was red with anger, and he was gesturing emphatically at the woman beside him. The woman, Linda, apparently sat perfectly still. She was staring straight ahead, her hands folded in her lap, her shoulders hunched slightly inward. She wore medical scrubs and a light jacket. Her face was carefully blank, but I could see the tension in her jaw, the way her fingers gripped each other so tightly her knuckles had gone white. Around them, other patients had stopped pretending not to listen. An elderly couple sat 2 chairs away, their faces etched with disapproval. A young mother had pulled her child closer. A teenager with his arm in a sling was filming the scene on his phone until his father nudged him to stop. Could have gone to urgent care, could have called your primary care doctor, but no. You always have to be so dramatic. "Sir," I said, approaching them, "I'm Dr. Coleman. Is there something I can help you with?" The man looked up at me, his anger immediately redirecting. "Yeah, you can help by actually seeing patients instead of making them wait for hours. My wife checked in at noon for some bullshit wrist pain, and we're still sitting here. What kind of emergency room makes people wait 2 hours?" I glanced at Linda's wrist. It was wrapped in an ace bandage. But what struck me more was the way she held it protectively, cradled against her body. Not the way someone holds a simple sprain. "Ma'am, are you the patient?" She nodded but didn't speak, didn't even look at me, just kept staring at the wall opposite her. "What happened to your wrist?" Before she could answer, her husband cut in. "She tripped over the vacuum cleaner this morning, probably just a sprain. But she insisted on coming here like it's a life-threatening emergency." I noticed the slight flinch Linda made when he said, "tripped." A micro-expression, gone in an instant, but it was there. "Sir, I understand the wait is frustrating." Frustrating? It's ridiculous. There are people here with colds, with scraped knees, taking up space while my wife sits here in actual pain. And why? Because you people can't triage properly. We triage based on the severity of the injury, sir. A sprained wrist is not immediately life-threatening. Don't give me that bureaucratic bullshit. I know how hospitals work. You drag out wait times to run up bills. It's a scam and everyone knows it. I took a breath, forcing myself to stay professional. If you'd like, I can check on your wife's status. Oh, now you're interested in helping after I complained? Typical. Several other patients in the waiting room were watching now. Some looked sympathetic. Others looked uncomfortable. Let me see what I can do, I said, starting to turn away. You know what the real problem is? The man continued, his voice rising. It's her. She's always doing this. Always making mountains out of molehills. Always dragging me to doctors for every little ache and pain. Last month it was stomach pain, turned out to be gas. Month before that, chest pain, anxiety. And now this. I stopped, turned back. Sir, she's a hypochondriac, a drama queen. But God forbid I point that out, because then I'm the bad guy. He looked at his wife with undisguised contempt. You're pathetic, Linda. You know that? Absolutely pathetic. The words hung in the air, vicious, cruel, designed to wound. Linda's face remained expressionless, but I saw her flinch, just slightly. A tiny contraction of her shoulders, a brief closing of her eyes. Then the mask was back in place. Around us, the waiting room had gone completely silent. Sir, that's enough, I said, my voice harder now. You need to treat your wife with respect, or I'll have to ask you to wait outside. Respect? I'll respect her when she stops wasting everyone's time with her fake injuries. Her injury isn't fake. She's here for medical evaluation, and we'll see her when it's her turn. Until then, I need you to remain calm and quiet, or security will escort you out. The man glared at me, clearly weighing his options. Finally, he slouched back in his chair, arms crossed. Fine, whatever. But this is taking too fucking long. I looked at Linda. Ma'am, I'm going to see if we can move your evaluation up in the queue. I'll be right back. She nodded mutely. But as I turned to walk away, I heard her voice, so quiet I almost missed it. Thank you. Just those 2 words. But they carried the weight of years of accumulated pain. I walked back to the triage desk, my jaw tight with anger. The triage nurse, Deborah, looked up at me with knowing eyes. That guy's been a problem since he got here, she said quietly. He's been berating his wife nonstop. What's her actual complaint? Deborah pulled up the chart. Linda Pacheco, 36 years old. Right wrist pain after a fall this morning. She's a paramedic actually. Works for County EMS. Told me she fell at home, landed on her outstretched hand, heard a pop. Wrist is swollen and painful. Any red flags in her history? Deborah hesitated. She's been here before, 3 times in the past 6 months. Once for rib pain after falling down the stairs. Once for a facial laceration after she walked into a cabinet door. And once for abdominal pain that turned out to be a kidney contusion. She said she slipped in the shower. The pattern was obvious and damning. Did anyone document suspicion of domestic violence? Not officially, but I remember the last visit. She had bruises in various stages of healing, defensive injuries on her forearms. I asked her directly if she was safe at home, and she said yes. Said she was just clumsy, and now she's back with her husband, who's verbally abusing her in our waiting room. Yeah, Deborah's expression was grim. But unless she tells us she's being abused, there's not much we can do. I knew Deborah was right. We couldn't force Linda to accept help, but our job wasn't just to treat injuries. It was to provide resources and a safe space for patients to disclose abuse. Put her in a room, I said. I'll see her next. And let's make sure she's alone when I do the evaluation. Her husband won't like that. I don't care what her husband likes. Deborah nodded approvingly. Room 7 is open. I watched as Deborah approached Linda and her husband. I couldn't hear what she said, but I saw the husband's face darken. He stood up, started to follow Linda. Deborah held up a hand, spoke firmly. The husband argued, gesturing emphatically. Deborah remained calm, immovable. Finally, the husband threw up his hands and stalked back to his seat, muttering angrily. Linda walked through the doors into the treatment area. As she passed me, I got a closer look at her face. No visible bruises, but there was something haunted in her eyes, something defeated. I gave her a few minutes to get settled, then grabbed a tablet and headed to room 7. Linda sat on the edge of the exam table, her injured wrist cradled in her lap. She'd removed her jacket, revealing short-sleeved scrubs. On her right bicep, I noticed a small tattoo, a medical caduceus with wings. "Hi, Linda. I'm Dr. Coleman. I understand you injured your wrist this morning?" "Yes." Her voice was soft, carefully modulated. "I fell at home. Landed on my hand wrong. Can you tell me exactly what happened?" "I tripped over the vacuum cleaner, fell forward, put my hand out to catch myself. I heard a pop and felt immediate pain." The story was plausible, but there was something rehearsed about the delivery. "What time did this happen?" "Around 9 this morning. And you waited several hours before coming in. Why?" A hesitation. "I thought it might just be a bad sprain, but the pain kept getting worse." I nodded, making notes. "Linda, I saw in your chart that you're a paramedic with County Ems. Is that right?" "Yes, 5 years now. So you're familiar with orthopedic injuries. You probably see them all the time." "I do. And as a paramedic, you'd know the difference between a bad sprain and a possible fracture." She met my eyes for the first time. There was intelligence there and wariness. "Yes, I would. So when you felt the pop and saw the immediate swelling, you probably suspected a fracture right away." "I thought it was possible. But you waited several hours. Why?" Another hesitation, longer this time. "I wanted to see if it would get better on its own." "Linda, as a medical professional, you know that's not how fractures work." She looked away. "I just ... I didn't want to make a big deal out of it. Because your husband thinks you make too big a deal out of injuries?" Her shoulders tensed. "He's just frustrated with me. I know it seems like I'm here all the time. You're here because you're injured and you need medical care. He thinks I'm being dramatic. What do you think?" She looked at me again, and for a moment, I saw something crack in that carefully maintained facade. A glimpse of pain that had nothing to do with her wrist. "I think I fell and hurt my wrist, and it might be broken, and I need it examined." "Okay, let's take a look." I pulled on gloves and gently examined her wrist. It was swollen, with visible bruising starting to develop. When I palpated the anatomical snuff box, she winced. "Pain in the snuff box. Possible scaphoid fracture. Can you make a fist?" She tried. Her fingers curled slightly, but the motion was clearly painful. "We're going to need x-rays. I'm also concerned about the mechanism of injury. Falling on an outstretched hand can cause fractures in multiple bones." "I know," she said quietly. "I've seen it before." I finished my examination, checking her neurovascular status. Everything intact, but the swelling was significant. "Linda," I said, sitting down so I was at eye level with her, "I need to ask you some questions, and I need you to know that your answers are confidential." She stiffened. "What kind of questions?" "I've noticed you've been to this EO several times in the past 6 months. Each time for injuries that you attributed to falls or accidents." "I'm clumsy. I've always been clumsy. You're a paramedic. Your job requires physical coordination, quick reflexes. That doesn't sound like someone who's clumsy. Everyone has accidents." "Linda, are you safe at home?" "Yes." "Has anyone hurt you? Your husband, a family member, anyone?" "No." "Has your husband ever hit you, pushed you, or physically harmed you?" "No." The answer came too quickly, too automatic. "I saw how he spoke to you in the waiting room. He was just frustrated. He didn't mean those things. He called you pathetic. He humiliated you in front of 24 strangers. He was upset." "It's fine. It's not fine. No one should speak to their partner that way. Dr. Coleman, I appreciate your concern, but I don't need a lecture about my marriage. I need my wrist looked at so I can go home." The walls were back up. Whatever momentary crack I'd seen was sealed shut now. I stood up. "Okay, I'm going to order x-rays. The tech will be in shortly. After we see the images, we'll discuss treatment options." "Thank you." I paused at the door. "Linda, if you ever need help, if you ever feel unsafe, the nurses can provide you with resources. Counseling services, domestic violence advocates, safe places to stay. No judgment, no pressure." She nodded but didn't respond. I left the room feeling frustrated and helpless. Everything screamed domestic violence. But without Linda's cooperation, my hands were tied. All I could do was treat her wrist, document my concerns, and hope she'd reach out before the next accident. The x-rays confirmed what I'd suspected, a scaphoid fracture with possible carpal bone involvement. I was reviewing the images when Deborah appeared. "Linda's husband is causing problems again," she said quietly. "He's demanding to see her. He's right that he can, but I want to discuss her treatment with her privately first." I told him that. He said he doesn't trust us. I sighed. "Let me talk to Linda first, then I'll brief him separately." I printed the x-ray images and headed back to room 7. Linda was scrolling through her phone. She looked up when I entered. "What did the x-rays show?" I showed her the images. "You have a fracture of the scaphoid bone here. It's displaced. You also have some concerning findings that suggest ligament damage. So I need surgery." "Most likely, yes. Open reduction and internal fixation surgery to realign the bone and secure it with screws or pins." Linda closed her eyes briefly. "How long is the recovery?" 6 to 8 weeks in a cast, then physical therapy. Total recovery time could be 3 to 4 months, and I can't work during that time. Not as a paramedic, no. So I'll be on medical leave. Without pay. She opened her eyes. "My husband is going to be furious." "Linda, this isn't your fault. He'll say it is. He'll say now he has to support both of us while I sit at home doing nothing. You'll be recovering from an injury. He won't see it that way." She looked at me directly. "Dr. Coleman, I need you to do me a favor." "What kind of favor?" "When you talk to my husband about the treatment plan, I need you to make it very clear that surgery is medically necessary, not optional." Medically necessary. The request told me everything. She needed a doctor to validate her injury because her husband wouldn't believe her. "I will absolutely make that clear," I said. "And Linda, are you sure you're safe going home with your husband?" "I'm fine," she said, cutting me off. "Please just explain the surgery to him." "Okay, I'm going to consult with orthopedics. They'll probably want to see you in the next day or 2. In the meantime, we'll put your wrist in a temporary splint." "Thank you." I left the room and found Linda's husband pacing in the hallway. When he saw me, he strode over aggressively. "What's taking so long? Is it broken or not?" "Mr. Pacheco, your wife has a scaphoid fracture that requires surgical repair." "Surgery?" His face darkened. "How much is that going to cost?" "I don't have specific cost information, but your insurance." "Our insurance has a $5,000 deductible, so we're looking at $5,000 out of pocket for a broken wrist." "It's not just a broken wrist, sir. The scaphoid bone is critical for wrist function. If it doesn't heal properly, your wife could have permanent disability. If she'd been more careful, this wouldn't have happened. But no, and now I'm supposed to fork over $5,000 for her carelessness." I felt my temper flare. "Mr. Pacheco, your wife had an accident. She needs surgery, and delaying treatment will only make things worse." "Of course you'd say that. You people always want to do the most expensive option." "What about a cast?" "For this type of fracture, conservative treatment has a high failure rate. She could end up with a malunion, requiring more extensive surgery later." "I want a second opinion." "That's your right. But, and I'm not authorizing any surgery until I've consulted with our insurance company." "Mr. Pacheco, your wife is an adult. She doesn't need your authorization." His expression turned ugly. "She's my wife. We make decisions together. The decision is hers." "We'll see about that." He pushed past me into room 7. I followed, ready to intervene, but Mr. Pacheco's tone with his wife was different. Still controlling, but less overtly aggressive. "Linda, the doctor says you need surgery. That's going to cost us $5,000. We need to think about this. Maybe get a second opinion." Dr. Coleman explained that surgery is necessary. Doctors always say things are necessary. "Remember that specialist? We didn't do it, and you were fine." "I wasn't fine. I was in pain for months. But you got over it eventually, without spending thousands of dollars." He crossed his arms. "Maybe we can schedule it for next year after we've met our deductible." "It's already been 8 hours since the injury," I interjected. "Delaying surgery increases complications. The orthopedist wants to get paid," Robert shot back. "Mr. Pacheco, your wife's long-term health. Don't lecture me. I know what's best for my family." Linda sat silently through this exchange, her head bowed. "Linda," I said, addressing her directly, "this is your decision. If you want surgery, we'll schedule it." She glanced at her husband, then back at me. "Can I have some time to think about it?" "Of course. Fine," Robert said tersely. "How much longer is this going to take?" "Probably another hour or two for the splinting and discharge paperwork. Jesus Christ. I'm going to miss dinner, all because of this nonsense." He stalked out. Linda watched him go. "I'm sorry about him," she said quietly. "I wanted to say that he seemed exactly like this. But I also knew that confronting her directly would only make her defensive." "Linda, the offer still stands. If you need resources, I can arrange that. I don't need that. I just need my wrist fixed." "Okay, I'll send the orthopedic resident down." I left the room feeling deeply troubled. Every instinct told me that Linda Pacheco was in danger. But without her cooperation, there was nothing I could do except document my concerns. I was reviewing labs when Deborah found me again. "Linda Pacheco's husband is causing another scene in the waiting room." "What now?" "Complaining about the wait time again." Loudly, I sighed. "I'll go talk to him." I headed toward the waiting room. When I rounded the corner, I saw something that stopped me cold. Robert Pacheco was standing near the vending machines, arguing with a woman trying to use it. She'd apparently pressed the wrong button, and a bag of chips had gotten stuck. "Why don't you people know how to use a simple vending machine?" Robert was saying. "Just hit the button again." "Sir, I did hit the button," the woman said patiently. "The chips are stuck. Typical hospital incompetence." He shoved some bills into the machine, punched a button aggressively. A candy bar dropped down. He grabbed it, started to open it. Then he paused, looked at the label. "Shit, this has peanuts in it." "I'm allergic to peanuts." The woman looked up. "You're allergic, but you bought it anyway?" "I didn't look at the label." "You should always check. Don't tell me what I should do." Robert threw the candy bar at the trash can. It missed, landed on the floor. "This whole place is a disaster." "Sir, if you're allergic to peanuts, you should be more careful," the woman said. "I don't need a lecture from some nurse about my allergies." "Then maybe you should read labels. Maybe you should mind your own business." The woman shook her head and walked away. Robert glared after her, muttering angrily. I started to approach when something caught my attention. Robert had picked up the candy bar from the floor, examined it again, then set it on top of the vending machine. But his hand went back to it. Once, twice, like he was considering eating it despite knowing it contained an allergen. Was he actually allergic to peanuts? I filed the observation away and approached him. "Mr. Pacheco, I wanted to give you an update on your wife's care." He turned to me. "About time. What's the holdup?" "We're waiting for the orthopedic resident. Should be another 30 minutes. Then we'll splint her wrist and you can go home." "Another 30 minutes? Are you kidding me? Orthopedics is in surgery. They'll be down as soon as they're available. This is unacceptable. We've been here for over 4 hours. Your wife has a significant injury that requires specialist input. We're not going to rush her care. I have to get back to work tomorrow. I can't sit here all night. You're welcome to leave if you need to. Your wife can call you when she's ready." "Oh, that's rich. Leave my wife here alone." What kind of husband do you think I am? The kind who humiliates his wife in a crowded waiting room, I thought. But I didn't say it. "The choice is yours. But we'll have your wife ready in about an hour." "Fine, whatever." He pulled out his phone, started scrolling dismissively. I turned to head back when I heard it. A sound like a gasp. A wet, choking sound. I spun around. Robert Pacheco was clutching his throat, his eyes wide with panic. His phone clattered to the floor. He took 2 stumbling steps toward me, his mouth opening and closing. No sound coming out except that horrible wheezing. "Mr. Pacheco?" His face was already starting to turn red. He pointed at his throat, still trying to speak. Behind me, someone shouted, "He can't breathe." And that's when I realized he'd eaten the candy bar, the one with peanuts. He was having an anaphylactic reaction. Right here, right now. And the only person who knew his complete medical history was standing 15 feet away against the wall. Linda Pacheco, his wife, watching in silence as her husband died. The EpiPen does its job, but not fast enough. Robert Pacheco collapses to his knees, then falls sideways onto the dirty waiting room floor. His body convulses once, twice, then goes still. His chest makes irregular, gasping movements, agonal breathing. "Code Blue, our waiting room," someone announces. "Code Blue, our waiting room." The crash cart arrives in seconds. Nurses swarm around us. Someone tilts Robert's head back. Someone else starts chest compressions. "Get me a laryngoscope," I bark. "We need to intubate." A nurse hands me the kit. I grab the laryngoscope, position myself at Robert's head. His tongue is so swollen, it's protruding from his mouth. When I look down his throat, I see nothing but inflamed tissue. No opening. I can't see the cords. Airway is completely blocked. Dr. Patel appears beside me. "How long since the EP?" 2 minutes. Maybe 3. "It's not working fast enough. We need a surgical airway." She looks at the nurse. "Crick kit. Now." The nurse runs to get it. I keep trying to visualize the vocal cords, but there's nothing. Just swollen, angry tissue. "Oxygen sat is dropping," someone calls out. 78%. "Keep bagging him." Patel takes the cricothyrotomy kit, opens it. "Marcus, hold his head perfectly still." I position myself at Robert's head, hands on either side of his jaw. Patel feels for the cricothyroid membrane. Membrane identified. She makes a small horizontal incision, then inserts a trocar through the membrane. "I'm in." She removes the trocar, leaving the cannula, and attaches a bag valve device. "Bag him." The respiratory therapist squeezes the bag. Once, twice. "Sat's coming up," the nurse reports. 85, 88. "Good. Keep going." Patel looks at me. "How much EP did you give him?" 0.3 milligrams IM. "Give him another dose. And start in 4. Get me methylprednisone, diphenhydramine, and another liter of normal saline." Nurses move to comply. I grab another EpiPen, administer the second dose. "Sat's at 92, the nurse reports. Heart rate 138. Blood pressure 80/52. He's still in shock. Let's get him into a trauma bay. I want continuous monitoring, and I want anesthesia down here." 4 people lift Robert onto a gurney. The respiratory therapist continues bagging him. We wheel him toward the trauma bay. As we pass through the waiting room, I glance toward where Linda was standing. She's still there, arms still crossed, face still expressionless. She hasn't moved, hasn't offered to help, hasn't provided any information. She's just watching. Our eyes meet for a brief second. I see no fear there, no panic, just that same cold expression. Then we're through the doors, and Linda disappears from view. "Okay, he's stabilized for now," Dr. Patel says 15 minutes later. "The crick is functioning. Sats are holding at 95. Blood pressure has improved with fluids. But he's still having a massive anaphylactic reaction. The EP and steroids should start working soon." They should. But I'm concerned about rebound anaphylaxis. He's going to need to be admitted to the ICU. Robert is unconscious, sedated. His face is still swollen, but the purple color has faded. Monitors beep steadily. "What the hell happened?" Patel asks. 1 minute he was yelling, the next he was dying. He ate something he was allergic to, a candy bar with peanuts. Knowingly? I think so. He looked at the label, saw it had peanuts, threw it away, then picked it back up and ate it anyway. Patel frowns. That doesn't make sense. Maybe he didn't think his allergy was that serious. Or maybe he didn't want to admit he'd made a mistake. That's incredibly stupid. Yes, it is. Patel shakes her head. His stupidity almost killed him. If you hadn't been right there. A nurse appears. "Dr. Coleman? The patient's wife is asking to see him. Tell her we'll come out and brief her in a few minutes." The nurse nods and disappears. Patel turns to me. "You were the one who saw him in the waiting room, right? You know the wife? I treated her earlier, wrist fracture. And yes, I know about their relationship dynamic, which is," I hesitate, "I suspect domestic violence. She has a pattern of injuries. He's been verbally aggressive all afternoon. And when he started dying, she just stood there." Patel's expression darkens. "Are you saying she wanted him to die?" "I don't know. Maybe. Or maybe she was so used to being helpless that she froze. Concerning enough to document? I already documented my concerns about domestic violence. But this her failure to help, I should probably document that too. Do it. And when we brief her, I'll be there. I want to see her reaction. We finish stabilizing Robert, then head toward the consultation room. Linda is already waiting, sitting in one of the plastic chairs. She's alone. She looks up when we enter, her face calm. "Mrs. Pacheco, I'm Dr. Patel. I'm the attending physician overseeing your husband's care. How is he?" Linda's voice is steady. "He's stable, but he had a severe anaphylactic reaction. We had to perform an emergency cricothyrotomy. He's sedated and on a ventilator. Because he ate peanuts." "Yes, doctor. Coleman said you told him that your husband is allergic to shellfish. Did he also have a peanut allergy?" "He's allergic to peanuts, tree nuts, shellfish, and bee stings. Severe allergies. He carries an EpiPen." I stare at her. "You knew he had multiple severe allergies, and you didn't mention any of them until I specifically asked about shellfish? You asked if he had allergies. I told you about the shellfish because that's what he ate. The peanut allergy wasn't relevant at that moment. It became relevant when he started dying," Patel says. "You were standing right there. You could have told us immediately, but you didn't. You just stood there." Linda meets Patel's gaze. "I was in shock. I didn't know what to do. You're a paramedic. You've dealt with anaphylaxis dozens of times." "At work, yes. But this was my husband." I panicked. The words sound right, but there's no emotion in her voice. "Mrs. Pacheco," I say carefully, "when I first asked for information, you were silent for almost 15 seconds. Why didn't you speak up immediately?" "I was trying to process what was happening." "For 15 seconds? While your husband was turning blue?" Her jaw tightens. "Dr. Coleman, I don't appreciate your tone. My husband almost died. I'm upset. I made mistakes. I'm sorry if that's not good enough for you." Patel holds up a hand. "Let's focus on what's happening now. Your husband is going to be admitted to the ICU for observation. He'll remain sedated through the surgical airway until the swelling goes down. How long will that take? Probably 24 to 48 hours. Then he'll need a few days to recover." Linda nods slowly. "And after that, will he be okay?" "Assuming no complications, yes. He should make a full recovery." Something flickers across Linda's face. Disappointment? Relief? It's gone too quickly. "Can I see him?" "In a little while. We're still getting him settled." "Okay, thank you." Linda stands, starts to leave, then pauses. "Oh, and Dr. Coleman? I've decided to have the surgery on my wrist. You were right. I'll call the orthopedic office tomorrow." She leaves before I can respond. Patel and I stand in silence. Then Patel says, "That woman is either traumatized and dissociating, or she's one of the coldest people I've ever met. Or both," I say quietly. "You really think she's being abused?" "I know she is. The pattern of injuries, the control in husband, it's textbook. But proving it, getting her to accept help, that's the hard part. And now her abuser almost died in front of her, while she watched. Yeah, Marcus, that's going to haunt her. I'll make sure social services reaches out." "Good. And document everything." I nod. We head back to check on Robert one more time. He's still unconscious, still swollen, but stable. The crisis has passed. But I can't shake the image of Linda standing against that wall. Was she frozen by trauma? Or was she making a choice? And if it was a choice, what does that make her? A victim who finally fought back? Or something else entirely? Robert Pacheco doesn't wake up. Not in the first 24 hours. Not in the 48 hours after that. He remains deeply sedated, his body fighting the aftermath of the anaphylactic reaction. The ICU team tries to lighten his sedation on day 3. His eyes flutter open briefly, but he doesn't respond to commands. His pupils are reactive, his reflexes intact, but there's no one home behind those eyes. Anoxic brain injury, the neurologist tells me. We won't know the extent until he wakes up, if he wakes up. What are his chances? Of waking up? Maybe 60%. Of meaningful recovery? Maybe 30%. Of returning to baseline? Less than 10%. The numbers are grim, but not impossible. Linda visits every day. She sits by his bedside for exactly 1 hour. She doesn't hold his hand, doesn't talk to him, just sits there, reading on her phone. I see her on day 4. She's in her usual chair, her injured wrist now in a proper cast. "Mrs. Pacheco," I say. "How are you doing?" She looks up. "I'm fine. How is Robert?" "The same. No change since yesterday. That's what they keep telling me." She sets her phone down. "Dr. Coleman, can I ask you something?" "Of course." "If he wakes up when he wakes up, will he be the same?" I sit down across from her. "Honestly, probably not. The brain injury can cause cognitive impairment, memory problems, personality changes. But he'll be alive. Yes, he'll be alive." She nods slowly. "And if he doesn't wake up?" "That depends on his advance directives." "Do you know if he ever discussed what he'd want?" "No, we never talked about it. He always said he'd live forever." A bitter smile. "Guess he was wrong. Mrs. Pacheco, I know this is difficult. Do you?" She looks at me directly. "Do you know what it's like to watch someone who hurt you fight for their life? To sit here knowing that he might wake up, that things might go back to the way they were?" There it is, the first open acknowledgement. "Linda, are you safe at home? If Robert wakes up, do you have somewhere else you can go?" She's quiet for a long moment. Then, "Do you know what Robert did the morning I broke my wrist?" I shake my head. "He shoved me. We were arguing about something stupid, and he got angry and shoved me. Hard. I fell backward, put my hand out, and heard the pop. I knew immediately it was broken." "Linda, and do you know what he said?" "He said it was my fault for being clumsy. Then he made me wait 4 hours before he'd bring me to the E. I'm so sorry. The rib injury last year? He punched me. The facial laceration? He threw a glass at me. The kidney contusion? He kicked me when I was on the ground." Her voice is flat, clinical. "Every injury has been because of him. And I've lied about all of them. Why didn't you tell anyone?" "Because I was scared. Because he told me he'd kill me if I ever left. Because I didn't think anyone would believe me." She looks at her hands. "And because part of me thought I deserved it. None of that is true. You didn't deserve any of it. I know that now. Sitting here for the past 4 days, I've had a lot of time to think. And I realized something." "What's that?" "When I saw him choking, when I saw him turning blue, I felt nothing. No fear, no panic, just nothing. And when you asked me about his allergies, I knew I could tell you everything immediately. And I waited anyway." My chest tightens. "Linda, I didn't want him to die exactly. But I didn't want him to live either. I just wanted it to be over. To not have to make the choice myself." She meets my eyes. "Does that make me a terrible person?" I think about the ethics, about the moral complexity of a victim who watches her abuser suffer. "No," I say finally. "It makes you human. You were traumatized, you were in an impossible situation, and you froze. But I didn't really freeze, did I? I made a choice. I chose to wait. I chose to let him suffer, just for a few seconds. Just to see what it felt like to have power over him. Linda, you've been living with abuse for years. The psychological impact, it's profound. What you did in that moment doesn't define you. Or maybe it was the real me. The person I've become because of what he did to me." She stands up. "I need to go. My hour's up." "Wait, Linda, please. Let me connect you with a social worker, with a domestic violence advocate. I'm not going through anything anymore. Robert's in a coma. For the first time in 3 years, I'm safe." She picks up her purse. "Thank you for your concern, Dr. Coleman, but I'm fine." She walks out, leaving me with more questions than answers. On day 7, Robert wakes up. I'm not there when it happens, but I hear about it from one of the ICU nurses. "Your patient in CQ bed 3, Robert Pacheco?" He opened his eyes this morning, started following commands. "They extubated him an hour ago." "That's great news." "Yeah, except there's a problem. He can't remember anything from the week before his collapse. The neurologist says it's probably due to the hypoxic injury." "Does he remember his wife?" "Oh yeah, he remembers her fine. Keeps asking for her." I feel a chill. "Is she there now?" "No, we called her, but she said she'd come by later." She sounded flat. After my shift stabilizes, I head up to check on Robert. He's sitting up in bed, oxygen cannula in his nose. looking pale but alert. When he sees me, he frowns. "Do I know you?" "I'm Dr. Coleman. I was one of the physicians who treated you when you had your anaphylactic reaction." "Anaphylactic?" He touches his throat, winces. "What happened?" "You consumed a candy bar that contained peanuts. Your airway swelled shut, and we had to perform an emergency cricothyrotomy." He processes this. "But I know I'm allergic to peanuts." "Why would I eat something with peanuts?" "We don't know. Perhaps you didn't check the label." "And Linda, my wife, she was there?" "Yes, she was in the waiting room when it happened." "Is she okay?" The concern in his voice sounds genuine. "She's fine. She fractured her wrist earlier that day, but it's been surgically repaired." "Good. That's good." He leans back, exhausted. "I need to talk to her. There's something I need to say. I'm sure she'll be here soon." "No, I mean I need to apologize for how I've been treating her. The nurses told me I was yelling at her in the waiting room. Is that true?" I choose my words carefully. "You were frustrated about the wait time. Jesus, Linda must hate me." He closes his eyes. "I've been terrible to her for a long time. I get angry. I say things I don't mean." He stops. "I need to make it right. When she gets here, I'm going to apologize. Tell her I'm going to change. Go to therapy, whatever it takes. It's a speech I've heard before from abusers. The promise is to change." "Mr. Pacheco, that's between you and your wife. But I'd encourage you to follow through on that therapy." "I will. I promise." He opens his eyes. Did I do something to Linda? I have this feeling that something happened, but I can't remember. Do I tell him? That his wife stood there and watched him choke? No, that's not my story to tell. "You didn't do anything to her that day," I say carefully. "She injured her wrist in a fall at home." He nods, but I can see the unease in his eyes. Some part of him knows there's more to the story. I leave him to rest, troubled by the conversation. Robert Pacheco is going to live. He's going to recover, and he's going to try to make amends. But Linda has tasted freedom. Is she going to give that up? Or is she going to take this opportunity to break free? Linda doesn't visit Robert for 3 days. The ICU nurses tell me he asks for her constantly. They give him vague answers. She's busy. She's recovering. She'll be there soon. On day 10, I'm finishing my shift when I see her in the hospital lobby. She's walking toward the elevators, dressed in civilian clothes, her cast-wrapped wrist held protectively. "Linda," I call out. She stops, turns. When she sees me, something in her expression shifts. Not quite a smile, but close. "Dr. Coleman, I was hoping I'd run into you. You're going up to see Robert?" "Yes. I've put it off long enough." She says it lightly, but I hear the tension underneath. "Can I walk with you?" "Sure." We step into the elevator. Linda presses the button. The doors close. "The nurses say he wants to apologize," Linda says finally. "That he's been asking for me, saying he wants to make things right." "He does. I spoke with him. He seems genuinely remorseful. He always is. After every incident, he's sorry. He promises to change. And he does change for a week or two. Then the anger comes back." She looks at her cast. "I've heard his apologies before. So what are you going to tell him?" "The truth, that I'm done. That I'm filing for divorce. That I've already moved my important belongings out. That he can keep everything else, I don't care. I just want out." The elevator dings. The doors open. "How do you think he'll react?" I ask. "I don't know. The old Robert would explode. But this Robert?" She gestures toward his room. "Who knows?" We walk to his room. Robert is awake, watching TV. When he sees Linda, his face lights up. "Linda, thank God." He stops when he sees her expression. "What's wrong?" Linda takes a breath. "Robert, we need to talk." I step back, giving them privacy, but I stay nearby. Through the glass wall, I watch as Linda speaks. I can't hear the words, but I can see Robert's face cycle through emotions: confusion, disbelief, anger, desperation. He reaches for her hand. She pulls away. He starts talking faster, gesturing emphatically. She shakes her head, firm, final. He slumps back, defeated. Linda stands up, says something final, then turns and walks out. When she emerges, her face is calm, resolved. "How did it go?" I ask. better than expected. He didn't yell, just accepted it. Told me he understood. She pauses. I don't know if he meant it or if he's just too weak to fight, but either way, it's done. How do you feel? She thinks. Lighter, like I've been carrying something heavy for years and I finally put it down. She looks at me. Dr. Coleman, I want to thank you. For what? For treating me like I mattered. For asking the right questions. For documenting your concerns so that when I filed for divorce, I had medical records backing up my story. You gave me tools I didn't even know I needed. I just did my job. You did more than that. You saw me. Really saw me. She extends her good hand. Thank you. I shake her hand, feeling the strength in her grip. What are you going to do now? Heal, physically and mentally. I'm taking a leave of absence from work. After that, she shrugs. I don't know, but whatever I do, it'll be my choice, not his. She walks toward the elevators, her steps steady and sure. I watch her go. This woman who stood silent while her abuser died, who finally found her voice and her power. Was what she did right? Ethical? Justifiable? I don't know. Medical ethics are usually clear-cut, but real life is messy. Real life involves victims and abusers, trauma and survival. Impossible choices made in moments of crisis. Linda Pacheco made a choice in that waiting room. She waited. She delayed. She took back power in the only way she could. And maybe that makes her human rather than heroic. Maybe it makes her flawed rather than perfect. But it also makes her free. 3 months later, I'm in the eye when a familiar figure walks through the doors. Linda Pacheco. No longer in scrubs but wearing business casual. Her cast is gone, replaced by a compression sleeve. She looks good, healthy, stronger than I've ever seen her. Linda, I say surprised. Are you back at work? Not yet. Another month before I'm cleared, but I'm here for something else. She holds up a folder. I wanted to give you this. I take the folder, open it. Inside is a stack of papers, legal documents, court filings. Divorce papers, Linda explains. Finalized last week. The judge granted me everything: restraining order, division of assets, sole ownership of our house. Robert didn't contest any of it. How is he doing? Physically? He's recovered well. Back to work. Mentally, she shrugs. I don't know, we don't speak. But I heard he's in therapy. And you? I'm good, really good. I found a therapist who specializes in domestic violence survivors. I'm working through a lot: the guilt, the shame, the fear. But I'm making progress. That's wonderful. I also wanted to tell you something. She sits down. When I stood there in the waiting room, watching Robert choke, I had a moment of clarity. I realized that I had power, real power. His life was in my hands, and I could choose what to do with that power. Linda, I'm not proud of what I did, withholding information that wasn't right, but it was the first time in 3 years that I felt like I had any control. She looks at me. Does that make sense? It does. But Linda, you always mattered. His abuse didn't change that. I know that intellectually. But feeling it? That's taken a lot of work. She stands up. Anyway, I wanted to give you those papers because your notes were part of the evidence that helped me get the restraining order. I'm glad they were useful. More than useful. They might have saved my life. She extends her hand. Thank you, Dr. Coleman. You're welcome. And Linda? I'm proud of you. Thanks. That means a lot. She starts to leave, then pauses. Oh, one more thing. I'm thinking about becoming a domestic violence advocate, using my experience to help other women. I think it's perfect. You'd be amazing at it. She smiles, a real smile this time. I think so too. She walks out, back into her new life. What happened with Robert and Linda Pacheco wasn't clear-cut good versus evil. It was messy and complicated and morally ambiguous. But in the end, both of them survived. Both got second chances. Robert got the chance to recognize his behavior. Linda got the chance to escape and rebuild. And somewhere in that messy middle ground between justice and mercy, between action and inaction, between revenge and survival, that's where real life happens. That's where healing begins. 6 months after the incident, my phone buzzes with an email. It's from Linda Pacheco. Dr. Coleman, I completed my training as a domestic violence advocate, and have been volunteering at a local shelter for the past 2 months. It's the most meaningful work I've ever done. Last week, I was giving a presentation at a community health center about recognizing signs of domestic violence. After the presentation, a woman approached me, a nurse who worked at the center. She told me she'd been in an abusive relationship for 5 years, that she'd been to the ER multiple times with suspicious injuries, but no one ever asked the right questions. She said my presentation was the first time someone had put into words what she'd been experiencing, and she asked for help getting out. I've been working with her for the past week. She left her abuser 3 days ago. She's safe now. If you hadn't really seen me, on that day when I came in with my broken wrist, if you hadn't asked the right questions and documented your concerns, I might still be trapped, or worse. You saved my life, Dr. Coleman, not by performing some dramatic medical intervention, but by treating me with dignity and respect when I desperately needed both. And now, because you helped me, I'm able to help others. With gratitude, Linda Pacheco. I read the email twice, feeling a lump form in my throat. This is why I became a doctor. Not for the dramatic saves, but for moments like this. For the quiet impact of treating patients with dignity. I think about that day in the waiting room. About Robert humiliating Linda. About his anaphylactic reaction and her terrible silence. About the moral complexity of a victim who had to choose between saving her abuser and saving herself. But now I understand. She wasn't being cruel. She wasn't being vindictive. She was just a human being who'd been broken by years of abuse, trying to survive. And in that moment of terrible silence, she found her voice. She discovered her power. She took the first step toward freedom. Sometimes heroism doesn't look like we expect it to. Sometimes it looks like a woman standing silent while her abuser chokes. Sometimes it looks like choosing yourself when everyone expects you to choose someone else. And sometimes, miraculously, everyone survives. The abuser gets a chance to change. The victim gets a chance to heal. I close the email and turn my attention back to my work. But I'm smiling because today I learned something important. Sometimes heroes don't wear white coats. Sometimes they wear restraining orders and divorce papers and the scars of battles fought and survived. Sometimes they stand in waiting rooms, arms crossed, silent while their abusers choke. And sometimes, through that terrible silence, they find the voice they needed all along to finally say, I matter. My safety matters, my life matters, and they walk away free.